Hi, and welcome to Dr. Brainwaves. I'm Dr. Rena Azar, and today I'm going to talk about osteoarthritis, which is by far the most common form of arthritis that we see. It affects 10 to 15% of people by the time they are 60 years of age, a little bit more in women than men. Osteoarthritis is called the wear and tear arthritis. We're going to look at this little joint again. So we notice that joints have bones that rub on each other. And some of the protective measures that our body takes is that we have a cartilage type deposit on the ends of our bone called rubbery cartilage. It's orange there. There are little pads called meniscus pads that exist between the bone ends that help further to cushion that articulating or rubbing surface. And finally, the synovial membrane, which coats the surface in this joint, and it creates a nice moisturizing lubricant that goes in kind of like oil in the car and lubricates that joint to keep everything in there healthy and moist to allow for minimal friction in those rubbing areas. So when those areas break down from wear and tear, just physical stress of wear and tear, you'll mount an inflammatory response, meaning your body reacts from that wear and tear by bringing in parts of your immune system that will cause inflammation, swelling, irritation of that tissue. And then that whole process is called osteoarthritis, and it can result in deterioration of the synovial membrane cells, of the cartilage cells, and also of the actual bone. And the osteoarthritis is notable for having certain characteristics and being in a certain location. It's important to identify osteoarthritis because if you don't have osteoarthritis, you probably need to see somebody because things other than osteoarthritis oftentimes have a more rapid progression. Different types of arthritis tend to have a more rapid progression, and we also have more aggressive medications to give folks that have those other types of arthritis to prevent that rapid progression and deterioration of the bones. So the place that we normally see osteoarthritis is in the hand joints, the upper joint and the lower joint, not so much in the hand area, but in the finger joints rather. Also, in osteoarthritis, we get a lot of hip involvement, knee involvement, and spine involvement, specifically the C-spine or cervical spine, and the lower spine called the lumbar spine. Signs of arthritis are, as everybody knows, pain, and oftentimes people may have just even a little stiffness before it develops into pain, and then eventually people will notice some limited range of motion. And occasionally the joint can be so affected that the actual whole joint is warm to touch or it is swelling, and you can feel that swelling, that fluid retention in the joint. Things that worsen osteoarthritis are age, obesity, repetitive use, injury to an area will set up an environment in that joint where things aren't rubbing necessarily as well together, and so you're more likely to get arthritis. Bone deformities that you may have been born with, and there are a couple health issues that can affect joints, and that is diabetes and hemochromatosis are both known to affect the well-being of joints and promote osteoarthritis formation in the joints. We also want people to be aware of symptoms that might signal you to know that you may not have osteoarthritis. It may not be a wear and tear arthritis. You may have a different type of arthritis that needs a more vigorous treatment plan. So signs of that could be if you have pain that does not subside after about 30 minutes of moving around in the morning, pain that wakes you up or persists through the night when you're trying to rest, locations other than fingers, hips, knees, and the spine are a signal that maybe a different type of arthritis. Joints that lock or give way. As systemic symptoms like extreme fatigue, any fevers, loss of appetite. If you have those symptoms with your arthritis, probably need to take that to your provider and say, I need to be evaluated to see if I have a kind of a normal type of arthritis that comes from wear and tear, or if I have with that or aside from that an immune type of arthritis that is potentially very aggressive and deforming and therefore needs more aggressive treatment. Identification early and aggressive treatment. Osteoarthritis, as we said, is caused by damage to any of those components of the joint, And they're detected when we're trying to detect if you have arthritis. We're looking for those changes, sometimes with x-rays, sometimes with lab tests, sometimes with MRIs. Oftentimes the diagnosis of arthritis can be, however, clinical. So if the symptoms are mild and typical, oftentimes people may be diagnosed just clinically without specific imaging. However, if you have some of those other factors, you'll get yourself a bigger workup like we talked about. The main goal of treatment, once we identify osteoarthritis, is controlling the pain and the stiffness of the joints. So non-pharmacologic methods are always best, and we really encourage people to implement an exercise program and consider getting physical therapy or occupational therapy, meaning trying to find ways to have less wear and tear at home, in your exercise regime, and maybe at work. Some jobs entail a lot of heavy lifting, a lot of stairs. There are things that you can do to try to strengthen your muscles around the joints that have arthritis developing, and there are ways to assist your joints potentially with some different types of footwear, assistive devices. In addition, we like to encourage people to embrace an antioxidant dietary plan, and consider doing supplements such as chondroitin sulfate. We have got a whole video on supplements for arthritis that I think goes over a lot of that in detail, because arthritis is, like many body processes, an inflammatory one. After implementing some of these non-medication type things, you may want to consider doing a medication. There are topical numbing agents. There are oral analgesics like Tylenol and nonsteroidal anti-inflammatories. However, if you're having to take those frequently, you may need to consider protecting, for example, your gastrointestinal symptoms that may arise from taking excessive nonsteroidal anti-inflammatory agents. Those agents are notorious for being hard on your GI tract, especially. So there are also things that you will need to be checked for with a regular checking, usually about every 6 months. We'll check people who take frequent nonsteroidal anti-inflammatory agents to make sure that we're not getting some secondary effects from those medications. And finally, if those medications are not working for you, you may need to consider more aggressive treatment with steroids, which have an anti-inflammatory properties, or opioids even, with the overview of a pain medication clinic type setting. So it depends on the degree of pain you have, the degree of stiffness you have, but we like to encourage people to make dietary changes and to implement non-medical types of activities with guidance like physical or occupational therapy to minimize the wear and tear on the joints that are experiencing osteoarthritis. Hopefully you found that helpful as an overview of osteoarthritis. And in another video series, I'll be talking about surgeries that help as a final step with arthritis.